Hello, I'm Jonathan Boxall, a registered osteopath. I'm the Principal Osteopath at the Exeter Osteopathic Clinic and a partner at the Natural Health Practice in Cullompton, which is based at the College Surgery Partnership, Cullompton, Devon, UK. In this demonstration we're going to show you how to really loosen up that stiff lower lumbar spine, doing a really nice stretch called the cat stretch. This is one of my favourite stretches for loosening up those stiff lower vertebrae. I give it to a lot of my patients and I think you're going to find it really comfortable. So in order to understand why it's useful to create movement in the lower part of your spine, we'll just have a little look at what's actually going on inside there. What you have is your vertebral segments, okay, and between those we have these intervertebral discs. And we also have these little joints on the side, which are called the facet joints. And as we flex the spine, what happens is we actually open up these facet joints a little bit, and then as we extend, we close them. And we're also creating movement in the actual soft part of the discs. That's helping to circulate the fluids, bring nourishment into these joints, and disperse those chemicals, what are called the prostaglandins, which are actually causing that horrible dull ache, especially that stiffness which you feel in the morning. Okay, so now you're going to learn how to do a perfect cat stretch in a few easy steps. First of all, Beth, if you'd like to lean forward onto your hands, with your hands pointing forward and your toes pointing back. If your ankles don't feel comfortable with your toes pointing back like that, what you can do is roll up a towel and put it underneath your ankles, and that should bring your feet up, making them feel a lot more comfortable. Now we start the stretch off by exhaling as you bring the stomach towards the floor and creating a really lovely curve in the lower back. You see how the bottom comes up, the shoulders come up, and you can bring your head up just a little bit. That's lovely. Then clench the buttocks, and to make the stomach muscles nice and tight, inhale as you bring the stomach up and create a curve with your lower back, really concentrating on that lower back as it comes up. Just come up a little more, Beth. That's great. And now you can accentuate that even further by exhaling and really bringing up that lower back so that you create a lovely curve and you can you feel that stretch there? Mm-hmm. Fantastic. And then you inhale as you relax. Perfect. Okay. And from that point you can repeat exactly the same sequence, and you repeat it about 10 times. So starting off on all fours with the hands pointing forward and the toes pointing back, begin the stretch by exhaling as you bring the stomach towards the floor, creating a curve in your lower back. Notice that the bottom goes up a bit and the head goes up a little bit. Then clench the buttocks and tighten the stomach as you inhale and bring the back and the stomach up to create a curve in the opposite direction. And then to accentuate this curve, exhale and bring it even further to really stretch that lower back. And now inhale as you comfortably come back to the neutral position where you can continue the stretch from where you started. So now you've learned how to do a perfect cat stretch in order to mobilize those stiff segments in your lower lumbars. That's an exercise which you should start off with about 10 repetitions, and maybe as the days go on work up to 15 or 20 repetitions in a single session. And at the beginning I'd recommend doing 2, maybe 3 sessions a day, and once your back's feeling better you can reduce that to 1 set of repetitions, maybe in the morning, maybe in the evening, in order to maintain that sense of mobility. I need to sound a note of caution now. If you're doing the exercise and you're actually feeling worse, then you must stop doing it straight away. And as with any exercise, it's vital that you consult either a physician or a professional like an osteopath who can give you an opinion as to whether it's safe and beneficial to proceed with this exercise.